Hi, everyone. I'm Carrie Grogan, lead principal at Mindshare Partners. And I'm here with Bernie Wong to chat about our 2025 Mental Health at Work report that we did with Qualtrics. He leads our research team and has been doing these massive national surveys since 2019. This year, we took the pulse of 1,100 full-time employees to get a sense of how they're faring against a backdrop of intense financial and political uncertainty. So, Bernie, what's the overarching story being told by this year's data?
Well, first, hello, Carrie. It's great to be in the hot seat this time. The big picture story we found this year is that mental health challenges remain high in US workplaces. But when employers choose to invest in their people's mental health, it works. They see less burnout, depression, and anxiety, all of which are historically costly to employers in healthcare costs and employee retention. If you really drill down, we found a vast majority, that's 90% of US workers experiencing some level of a mental health challenge. The most common of which were burnout, depression, and anxiety, where over 50% of our respondents reported moderate to severe levels. That's quite high. People cited their top stressors as US politics, global events, and personal finances. But we also found that when employers decide to try to mitigate their workers' stress, it really pays off.
All of that really resonates with my experience this year too. But I'm curious going back a little bit. What's the backstory on these national surveys? I know that we've been doing them for several years.
Yeah, look, we all know mental health isn't something a lot of people talk about, let alone employees talking about it in a workplace setting. So when Mindshare Partners launched our very first survey in 2019, we wanted to understand not just workers' mental health, but also all the related factors. Were they comfortable talking about it at work? Were leaders advocating for it? Was work itself playing a positive influence in workers' well-being? So over the years, we've actually been really able to take snapshots of workers' experiences around mental health at work through really transformative periods of time in the past years, 6 years, as you can probably imagine. Our report this year comes at a time when there's tons of uncertainty around money, politics, the economy, and the role businesses play not only in the world, but in their workers' lives. We're seeing waves of layoffs and mandated returns to office, and a perception of some companies taking steps back in diversity, equity, and inclusion. So all of this can feel scary, but our report this year actually captures a story of hope too.
Hope. Tell me how. How's
Where's hope? Yeah, mental health is increasingly a part of work. We know that we're seeing this in our data. And what we're really seeing is that it's driving workers' level of productivity, what kinds of companies they want to work for, and whether they leave their jobs for mental health reasons. And the hope is, luckily, how employers respond is what makes the difference. We asked all of our respondents if they felt supported by their employer around their mental health, and those who agreed saw better outcomes around mental health and in trust in their organization and other positive indicators around engagement. So that's the message of hope, that employers can really make a difference if they choose to invest in their people. The last finding I wanted to shout out is that overall, most workers also see supporting fairness and inclusion at work as a good thing overall. We know that discrimination and harassment hurts workers' mental health, a groundbreaking piece of knowledge. And we know that feeling that things at work are fair and that we connect and belong at work, that's good for mental health. So at the end of the day, well, really in perpetuity looking to the future indefinitely, we have to understand that these principles of fairness and inclusion are an integral part of workers' mental health and well-being overall.
So in the report, we give employers some guidance. What are those top strategic recommendations?
Yeah. First, if you're one of the organizations who are investing in mental health, keep doing it, please. It's working. And in an uncertain future, it's important to grow these investments in smarter ways. Historically, those investments have been benefits and mindfulness programs and those meditation apps. Those are all really important and foundational, and it's not what workers always find most helpful. What our respondents in multiple surveys have told us in terms of what's most helpful is flexibility and good work-life balance or integration or whatever you want to call it, as well as a culture where they feel safe talking about it. These aren't things that you can just easily buy. but they are absolutely decided by the way you run your business and how you shape your culture day to day. I think a lot of this might sound very intuitive, work-life balance, flexibility, sure, but we're kind of entering a new backdrop of the world and society that just feels much more charged. So it's not just about work-life balance and not just about flexibility. It's about making it possible for your people to really navigate and contend with the state of the world in a way that feels healthy and sustainable long-term for them. So in that way, we've talked a bit at Mindshare around making well-being itself a core value in the way an organization's values drive its, strategy, its infrastructures, the investment it makes. All of this drives how your workers themselves experience work, from how work gets done to who and how you hire, to your policies and your programs and your benefits and what you measure in your employee engagement surveys, all of it. So rather than treat well-being as just a benefits issue, treat it as a core part of your organization's identity. And last but not least, just listen to your people. We're already in a charged political and economic climate, and we're seeing a real deterioration of trust between workers and employers, especially as we're not really out of the woods when it comes to the ongoing waves of layoffs and those mandated returns and more. We've unfortunately entered this era of change that's often delivered top down, that doesn't really consider the health and livelihoods of people or really working in partnership with the people impacted. So, really, that's all to say a healthy future is possible. It is absolutely possible. There is hope. You just have to choose to invest in it.
There is hope. You just have to choose to invest in it. That is a really good tagline to remember. Thanks, Bernie.
All right. Thank you, Carrie.